Hello, and welcome to a life-saving discussion that could make all the difference when seconds count. Have you ever wondered what you would do if someone right in front of you started choking? Would you freeze in panic or spring into action, armed with the knowledge to save a life? Choking is one of the scariest emergencies you can witness. It happens unexpectedly, at family dinners, during celebrations, or even in the workplace. According to the CDC, Centers for Disease Control and Prevention, choking is the fourth leading cause of unintentional death. Thousands of lives are lost each year because the right help didn't arrive in time. But here's the good news: knowing the right steps and acting quickly can save a life in less than a minute. That's exactly what we'll be teaching you today. Stay with us until the end of this video. We're not just sharing tips, we're empowering you with practical techniques, real-world scenarios, and expert-backed guidance. Whether you're at home, at a restaurant, or even alone, this information is vital. If you're ready to become someone's hero, give this video a like, share it widely, and subscribe for more life-saving content. Understanding choking. Why every second matters. Before we jump into the step-by-step guide, let's understand what choking really is. Choking occurs when a foreign object, often food, obstructs the airway, preventing oxygen from reaching the lungs. Without oxygen, brain damage can begin in as little as 4 minutes. There are two types of choking. Partial airway obstruction. The person can still breathe, but may be coughing or wheezing. Complete airway obstruction. The person cannot breathe, speak, or make any noise. This is a critical emergency. Recognizing the signs of choking. The first step in saving someone is recognizing that they are choking. Often, the person choking cannot tell you because they can't speak. Watch out for these signs: clutching their throat, the universal choking sign; gasping or wheezing sounds; inability to speak or cough; bluish lips or skin due to lack of oxygen; sudden collapse or fainting. Remember, choking is a silent emergency. Immediate action is crucial. Step 1. Stay calm and assess the situation. When you see someone choking, your initial reaction might be panic. But here's the truth: panic only delays help. Take a deep breath, focus, and assess the severity of the choking. If the person can cough forcefully, encourage them to keep coughing. This is the body's natural way of clearing the airway. If the person is struggling and cannot cough or speak, it's time to act immediately. Step 2. Call for help. Always ensure emergency services are on their way. If you're alone with the victim, shout for help. Delegate someone nearby to call emergency services while you proceed with the necessary steps. If you're the only one around, call 911 first and put the call on speaker. This ensures professional help is on its way while you assist the choking person. Step 3. The Heimlich Maneuver for adults and children over 1 year old. The Heimlich Maneuver, also known as abdominal thrusts, is the most effective way to dislodge an object from the airway. Here's how to do it step by step. Stand behind the person. Wrap your arms around their waist. Make a fist with one hand and place it just above their navel, below the rib cage. Grasp your fist with your other hand. Deliver quick, upward thrusts. Think of it as a J motion, up and in. Repeat until the object is expelled or the person becomes unresponsive. Pro tip: never perform abdominal thrusts on pregnant women or infants. For pregnant women, apply chest thrusts instead. And for infants, follow specialized techniques. If the person becomes unresponsive. If the choking person collapses or becomes unresponsive, you need to act even faster. Lower them to the ground and position them on their back. Call 911 if you haven't already. Begin CPR with chest compressions. This can help dislodge the object while maintaining blood flow to the brain. After 30 compressions, check the mouth. If you see the object, remove it carefully with your fingers. Never do a blind sweep, as it may push the object further. Repeat CPR until help arrives or the person revives. Special cases: infants. Under 1-year-old infants require a gentler approach due to their small size. If an infant is choking, lay the baby face down on your forearm, supporting their head and neck. Deliver 5 firm back blows between the shoulder blades with the heel of your hand. If the object doesn't come out, turn the infant onto their back and give 5 chest compressions using 2 fingers, pressing in the center of the chest just below the nipple line. Repeat the cycle of 5 back blows and 5 chest compressions until the object is expelled or the baby becomes unresponsive. What to do? If you're alone and choking. Choking while alone is terrifying, but you can still save yourself. Call 911 immediately, even if you can't speak. The dispatcher may trace your location. Perform the Heimlich Maneuver on yourself. Place your fist above your navel. Grab your fist with the other hand and press inward and upward. Use the edge of a chair or a sturdy object to apply additional force if needed. Continue until the object is expelled or help arrives. Myths about choking. You should ignore misinformation can cost lives. Let's debunk some common myths. Myth 1. Drinking water can push the object down. Truth. This can worsen the obstruction. Avoid drinking or eating when choking. Myth 2. Slapping the victim on the back while they're standing. Truth. Back blows should only be done when the person is leaning forward or lying face down. Myth 3. You'll always hear someone choking. Truth. Choking is often silent, so stay vigilant. Step 5. Prevention is better than cure. While knowing what to do during a choking emergency is essential, prevention is always the best strategy. For adults, chew food thoroughly, avoid talking or laughing while eating, and avoid excessive alcohol, which can dull reflexes. For children, keep small objects, toys, and hard foods out of reach. Supervise mealtime. For everyone, learn and teach choking first aid. Practice regularly to ensure confidence in emergencies. Step 6. Adjusting for pregnant or obese individuals. For pregnant individuals or those with abdominal obesity, traditional abdominal thrusts may not be effective or safe. Instead, use chest thrusts. Stand behind the person and place your arms under their armpits. Make a fist and position it on the middle of their sternum, avoiding the lower rib cage. Grasp your fist with your other hand. Perform quick, inward thrusts on the chest, similar to the Heimlich Maneuver, but targeting the sternum. Continue until the object is expelled or the person becomes unresponsive. These modifications ensure that the pressure is applied safely and effectively, reducing the risk of injury. Step 7. Support for someone in a wheelchair. If the choking person is in a wheelchair and cannot be easily removed, position yourself behind the wheelchair. Lock the wheels to ensure stability. Wrap your arms around their torso. Perform chest thrusts, similar to the technique used for pregnant individuals. Ensure the person is leaning slightly forward to prevent the object from moving deeper into the airway. In this scenario, being adaptable and calm is key. Step 8. Managing a partially obstructed airway. If someone has a partially obstructed airway, they can cough, wheeze, or speak. Avoid aggressive interventions. Instead, encourage them to keep coughing. This is the body's natural way of clearing the obstruction. Reassure them and monitor their condition closely. Do not pat their back unless they lean forward significantly, as this may worsen the blockage. If their condition worsens and they stop coughing, Switch to abdominal or chest thrusts immediately. Understanding the difference between partial and complete airway obstruction ensures you don't intervene prematurely. Step 9. After the object is expelled. Once the choking person has cleared the object, they may still require attention. Here's what to do next. Check for breathing. Ensure they are inhaling and exhaling normally. Look for injuries. Abdominal thrusts can sometimes cause bruising or internal injuries. Encourage medical evaluation. Even if the person seems fine, they should see a doctor to rule out complications such as airway irritation or small injuries. Provide emotional support. Choking can be traumatic. Reassure the person and help them feel safe. These follow-up steps are crucial for full recovery. Practice makes perfect. The techniques you've learned are effective, but they require practice to execute confidently in real situations. Here's how to prepare. Take a certified first aid course to practice abdominal thrusts, chest thrusts, and CPR under expert guidance. Use training mannequins to simulate different choking scenarios. Watch instructional videos regularly to reinforce your understanding. Teach your family, friends, and colleagues these techniques to create a network of prepared individuals. Preparedness is the cornerstone of effective emergency response. Empowering communities. Learn and share. Imagine a world where everyone knew how to respond to choking. Thousands of lives could be saved every year. Schools, workplaces, and communities should make basic first aid training mandatory. Consider taking a certified first aid course. Organizations like the American Red Cross and the American Heart Association offer accessible training programs. Your role in saving lives. Remember, you don't need to be a healthcare professional to save a life. Your willingness to learn and act can make you a hero. Take a moment to share this video or the knowledge you've gained today. Someone's life could depend on it. Conclusion. Choking emergencies demand immediate action, but with the right knowledge and calmness, anyone can make a difference. Whether it's a child, a colleague, or yourself, knowing what to do can mean the difference between life and death. Thank you for staying with us through this life-saving journey. If you found this guide helpful, give it a like, share it widely, and subscribe to our channel for more empowering content. Together, we can create a safer, better prepared world.